Drug knowledge classification. Enoxaparin is an anticoagulant or antithrombotic medication. It is used to treat deep vein thrombosis. The side effect is bleeding, fever, confusion, nausea, and edema. The dosage range is 1 milligram per kilogram, and the onset is unknown. The peak is 3 to 5 hours, and the duration is unknown. Nursing implication: I will assess patient for bleeding gum, hemorrhage. I will assess their vital signs. I will assess the injection site and skin area for any redness, any inflammation, any nodules, any rash in the site. So I have reviewed the policies, and under the policy of independent double check, I understand that enoxaparin is a high alert medication and requires an independent double check prior to administration. I also reviewed the policy of medication administration time, and I understand that enoxaparin is a high alert medication, and so it has to be administered at the prescribed time by the prescriber. So the exact time or the clinical time we have to administer the medication. So right now I want to go to I'll open the chart. I'm going to my patient's profile. So the patient's name is Sid Galen. His date of birth is 11/08/1965. Patient is allergic to penicillin and codeine. His MRI number is 344316. So his present history: Mr. Galen is 2 days post-operative. He tolerated the surgery well, but is experiencing complications due to infection. Mr. Galen's diabetes is unstable and wound healing is impaired. Mr. Galen is experiencing increased pain at the wound site. So the patient reports pain as 5/10 to the right calf, and patient continues on anticoagulant therapy for deep vein thrombosis. So the vital signs: the temperature is 37.5. His heart rate is 100 beats per minute. His respiratory rate is 18. His blood pressure is 130/75, and his oxygen saturation is 97%. So right now, for his lab results, his white blood cell is 16.7, which is high, and then his absolute neutrophil is 9.1. It is high. His absolute monocyte is 1.13. It is high. His absolute basophil is 0.24. It is high. And then his prothrombin time is low. His glom is 12.1. It's high. The glump is 12.3. It is high. And the glucose is 12, which is also high. But every other lab value is normal. Okay, so now I'm signing the signature sheet. 16/07/2020. My full name is Ngeni Ursula, and my status is SPN 2, and my signature, and then my initials. Okay, so I want to compare the doctor's order to the MA. So I'm comparing the doctor's order to the MA. Galen seed, 344316. The MR number is 344316, 344316. The date of birth is 11/08/1965, 11/08/1965. Patient is allergic to codeine and penicillin and codeine. And the medication is enoxaparin. And the dose is 1 milligram per kilogram, 1 milligram per kilogram. The subcutaneous the route is subcutaneous. Route is given every 12 hours. Given every 12 hours, and the site is the abdomen. And the time the medication is given is 9 a.m. And the reason why the patient is taking this medication is because they are on a therapy for a deep vein thrombosis. For special instructions, the patient's weight has to be taken weekly, and since this medication is a high alert medication, the medication has to be given at the exact time that is being prescribed for, like every 12 hours. It has to be administered at that time. So right now I'm going to I have pre-assessed the patient. And then I pre-assessed bleeding in their gums. I want to make sure there is no bleeding in the gum or any other side. This is because this medication is an anticoagulant, so if patient is bleeding, they cannot take this medication. So there is no bleeding in the gum, there's no hemorrhage, there is no nodules, no inflammation, no redness or tenderness in the side. I have assessed for the pain level of the patient. I also assessed the pain level of the patient, and I also assess their vital signs. So everything is intact, the side is intact, and patient can successfully take the medication. So I am doing my hand hygiene, and I'm opening my medication drawer, and I'm bringing out my medication. So I want to check the expiry date of this medication. It's September 2028. So right now I am comparing the medication container to the MA. So on the MA, the patient's name is Galenseed. I have Galenseed. The drug is enoxaparin. I have enoxaparin. The dose is 1 milligram per kilogram. The dose comes in 100 milligrams per 1 ml. So I have to do my calculations. The root is a subcutaneous root. And the side is the abdomen. The frequency is every 12 hours, and the time the patient is taking this medication is 9 a.m. And the reason why the patient is taking this medication is because they are on a therapy for a deep vein thrombosis. I want to do my second check. On the MA, the patient is Galenseed. On the medication container, I have Galenseed. The drug is enoxaparin. I have enoxaparin. The dose is 1 milligram per kilogram. The dose comes in 100 milligrams per 1 ml. The root is a subcutaneous root. The side is the abdomen, and the frequency is every 12 hours. And the time the patient is taking this medication is 9 a.m. And the reason why patient is taking this medication is because they are on the therapy for a deep vein thrombosis. So right now I want to do my first calculation. So the patient's weight is 75 kilograms. The dose is 1 milligram per kilogram. So I have 1 milligram per kilogram times kilogram, which is equals to 1 milligram per kilogram times 75 kilogram. Kilogram cancels kilogram, so I have 75 milligram. My formula is D over A times Q, which is equals to 75 milligram divided by 100 milligram times 1 ml. 75 divided by 100 times 1. So I have 0.75 mils. So I have 0.75 mils right there. 0.75 mils. That's my first calculation. So right now I want to prepare my medication. So my syringe is a 1 ml syringe, and then my blunt filled needle, and then my swab, and then the medication. So I'm swabbing the pot of the medication, of the vial. I'm cleaning the pot of the vial. And then I'm opening my 1 ml syringe using an aseptic technique. And then I'm opening my blunt filled needle using an aseptic technique as well. So the dose is 0.75 ml. So I want to infuse 0.75 ml of air into the vial. I'm infusing 0.75 ml of air into the vial. And then I'm flipping the vial and I'm pulling up my medication. I'll pull up a little bit more so that when I prime the syringe, I will be left with the exact dose of medication in the vial, in the syringe, sorry. So I want to get rid of every bubble in the syringe. I'm getting rid of every bubble in the syringe. So right now there are no bubbles in the syringe. So I'm changing from a blunt fill needle to the actual needle. Using an aseptic technique, I am going to change to the actual needle, and I want to expel any extra medication until I'm left with 0.75 ml of the medication. So right now I have 0.75 ml in here. I have 0.75 ml. So I'm going to do my third check. My third check, I'm comparing the medication container to the MA. So on the MA, I have gallon seed. The drug is enoxaparin. The dose is 1 milligram per kilogram. The dose is 1 milligram per kilogram, and I did conversion and I got 75 milligram. On the container, the dose is 100 milligram per ml. When I did my calculations, I got 0.75 mils, and then the route is a subcutaneous route. The site is the abdomen. The frequency is every 12 hours, and the time of administration is 9 a.m. The reason why the patient is taking this medication is because they are on a therapy for a deep vein thrombosis. So right now I want to do my second calculation. So the patient's weight is 75 kilogram, and the dose is 1 milligram per kilogram. So I am doing 1 milligram per kilogram times kilogram, which is equals to 1 milligram per kilogram times 75 kilograms. So kilogram cancels kilogram. I have 75 milligram. So I'm doing my D over A times Q, which is equals to 75 milligram divided by 100 milligram times 1 ml. So I have 75 divided by 100. I have 0.75 times 1. So I have 0.75 mils. So the dose is 0.75 mils, and what I have in my syringe is 0.75 mils. So I am going to call on my tester to come and double check my calculation. When the tester double checks my calculation, I am ready to go to the patient's bedroom to administer the medication. So I'll take my medication, I'll take my swab, and then I'll take my gloves. I'm taking my worksheet. And I'm taking my worksheet, and then I'm heading to the patient's bedside.